Hello, I'm Dr. Joseph Iannelli. I'm a chiropractor at the Iannelli Wellness Center in Turnersville, New Jersey. I want to share with you my own personal health history to help you decide whether or not that our office and my services can help you with your health concerns. My history starts when I was very young, my health history. And before I explain it to you, we don't want any violins playing. We just want to get this information out so that you could decide whether or not, again, that we can help you here at the Iannelli Wellness Center. When I was 2 years old, I was rushed to the hospital, and I was not breathing very well. My lips were turning blue. My parents thought that, of course I was sick. They needed to do something quickly. Got to the hospital, got evaluated, and after getting evaluated, the doctors came back in, basically told my parents that they should prepare for me passing because I probably wouldn't make it through the night. So what started off as a vacation ended up with family in the hospital and parents being told that they weren't going to leave there without their middle child, middle boy. The problem was that my lungs had filled up with so much fluid that I wasn't oxygenating. I wasn't getting enough oxygen to my body and my brain. So they thought that there was no way they were going to be able to get enough fluid out so that I can maintain oxygen level sufficiently to survive that night. So my mother and my father really, were floored. They knew that I was sick. They knew I was in trouble, but they thought getting me to a hospital was going to, be the key to getting me well. And they got out a lot of information in a short amount of time that evening. But my parents did not buy or accept the doctor's prognosis for me. I wasn't going to make it through the night. We were in a small hospital down towards the Jersey Shore, and they thought that if they got me into Philadelphia, which is where we were living at the time, that maybe that hospital or a hospital in Philadelphia would be able to do more. So they got me in an ambulance. We rushed to Philadelphia. Ambulance approaching speeds of 100 miles an hour with my dad following behind the ambulance. And I was doing pretty bad even in the ambulance. Gasping for air, oxygen was not being accepted, so wasn't sure I was even going to make the trip. We got to Children's Hospital of Philadelphia, and we don't know why the treatment worked there, but whatever they did there differently got me breathing on my own. And of course, it came out of it. So, the point of that is sometimes things can start off pretty rough for all of us, for our children. And it doesn't mean that you have to continue down that path. I mean, things can be turned around with the right care and with people that understand your condition. And we had two different prognoses from hospitals that were 60 miles apart, and probably two different outcomes too. And to regress, just to give you an idea about how bad it was down the shore. I mean, my parents had a priest come in to give me my last rites before they could get their heads clear enough to get me out of there. So it was pretty bad, but came out of it, of course, and became a healthy child up until I was 6 years old, riding a two-wheeler home to my house, and I noticed that something was wrong, but I couldn't quite figure out what was wrong as I was riding my bike, and all of a sudden my left leg went numb. After the leg went numb, I lost balance. I tipped over on the bicycle, and I shattered my left femur and my hip. So we went, my parents got me to the hospital again. They decided that a body cast is what I needed. And I was literally in a cast all the way down my left leg, up to my chest, and then halfway down my right leg with a bar in the middle. Unable to move around for 6 months I was in this cast. But shortly after breaking the leg and getting the cast off, we began to question, my mother particularly began to question how easily I broke my leg because she witnessed the fall. Thought that something wasn't right. Thought maybe that something wasn't right because she thought I broke it too easily. And after going to different doctors again, different hospitals, and finally getting a diagnosis of a bone disease called fibrous dysplasia, that she was proven right, that I did have a bone disease, the leg broke way too easily, and that I needed more than just a cast. I ended up breaking the leg and the hip and lower leg on the left side a total of 9 times, from 6 to about 15 years old. Missed a lot of school, was homeschooled a few years, and I developed pain in my hip because of all this, like unrelenting pain, just about daily. The docs that were caring for me at the time were suggesting to my mother and father that maybe what I needed was a home for sick boys, because I was fracturing my bones so many times that they were worried about infection, they were worried about blood clots, they were worried that one of the fractures might end up being much more serious than they were. My mother resisted, my father resisted. He said we could raise him at home. So for the next, between the ages of 6 and 15, my parents really watched me like a hawk. They didn't want any more fractures to happen. My dad got really good at actually putting casts on and repairing casts, because I broke my cast so many times. Going back and forth to the hospital was too much for them, so he learned how to repair casts. He built me things so I could stand up, because a lot of that time I was laying flat. I was in wheelchairs, crutches. So between 9 and 15 were rough years health-wise. When I was 16, my parents took me to the Eagles football doctor at the time, and he devised a surgery that would stabilize the bones, pinning the bones together. I can show you the x-ray real quick of the pins, and doing bone grafts, and even using cadaver bone to pack all of the tumor-like areas from the disease so that I wouldn't break every time I fell or was twisted. And that worked. We had that operation. At the time, it was the longest osteo operation in children's hospital history. I was 9 hours on the table. And it took me a year to recover from that operation. But I did. And I was able to start walking again and even run a little bit. The problem after pinning, though, was that I developed hip and back pain, and I always had a little bit of asthma, a wheeze, when I tried to run. And my mother was going to a chiropractor at the time. And I remember her telling me often to go to her chiropractor. And I just, for whatever reason, I was tired of doctors. I did not want to go. Eventually, though, I went. I went because she told me that she's not going to hear me feeling sorry for myself anymore unless I went to the chiropractor. And I went, and I was amazed that a lot of the things that I thought were inherent with the disease and because of the pins and the problem that I had were just alignment issues, and that I could line my hips and my leg back up and I would feel a lot better. And the bonus that I got out of it was my wheezing went away. When he adjusted my middle of my back, I immediately felt pressure off my lungs, my chest, and I could breathe a lot easier. I actually started running, I started participating in sports, I started lifting weights. My whole life changed at that point. So much so that I decided then, sophomore year of high school, that I wanted to become a chiropractor. My dad owned a print shop at the time. I was in printing class at the high school. I got out of printing, told my dad, I don't think this is for me, I want to do this thing called chiropractic. He was okay with it. They were totally fine, even though they owned their own print company, print shop. And I enrolled in college prep in high school. I went to Temple University and then to Life University outside of Atlanta, Georgia. So my health history is really extensive, and it started way before school. I studied everything that I was going through. I studied every possible way to try to heal myself. I was drinking carrot juice, when I was 15 and 16 years old, back in the 70s when it was not very popular. I worked out because I knew that muscles that protected a diseased bone were better than muscles that were not as strong. And the chiropractic care was very instrumental in me taking control over getting healthy again. And that's exactly the empowerment that I want to give to all my patients. I want them to know that they could get healthy because of what they learn about the healing process. And the healing process starts within, and sometimes it gets blocked because we get on roads that we think are correct because we listen to professionals, and I understand that, just like if my parents would listen to those doctors down at the shore. And it just is that some doctors are going to put us on paths that are more correct for us, and others might not be able to. Not that they don't want to, they just might not be able to. My experiences help my patients, and now I'm grateful for my health history. I'm grateful for all those years of not being able to walk. I'm grateful for my disease. It sounds crazy. Because when I became a chiropractor, now I recall all of the things I went through. And when people come to the office, I can relate to so many different scenarios. And it's not that I always know the answers, but we work hard to help our patients get on the right track to heal themselves. And it is about empowerment. The empowerment to get the knowledge, to heal yourself, to be your own best doctor. Thank you for your time. I hope that if you choose our center, that we can work together to get you to your optimal health, that's our goal, to get you healthy, and to get you to a point where you can say, wow, I can enjoy life. Thank you very much.